So I guess some of the interesting data from a UK perspective is thinking about how we're going to change upfront therapy for myeloma patients over the coming years. So we've seen updated data from both the Cassiopeia and the GRIFFIN studies looking at the addition of Daratumumab to upfront therapy for patients. So particularly the Daratumumab VTD combination in the Cassiopeia study is something we hope to be able to access for patients within the UK soon. And what we can see is that those patients who received the anti-CD38 antibody in combination with triplet induction had improved progression-free survival compared to patients who didn't. And that's something we're looking forward to hopefully being able to incorporate into UK practice soon. In terms of other data, for upfront patients, Martin Kaiser from the Institute of Cancer Research in Royal Marsden in London, one of my colleagues, presented data from the MUK Nine study. This is a study looking at specifically trying to address high-risk patients and how we can improve their outcomes. This was a study looking at a combination induction therapy followed by transplant consolidation and more intensive maintenance than we would give as standard of care, specifically looking at the group of patients with ultra-high risk disease who haven't benefited so much from the other advances we've made in myeloma therapy over the last few years. The results are really encouraging and appear to show improved outcomes when we compare it to a historical cohort of ultra-high risk patients from the Myeloma 11 trial. In terms of other things that are on the horizon and we hope to be able to access in the UK, we've seen lots of exciting data from bispecific antibody studies as well as CAR T therapies, which really, we are currently still in clinical trials, but hopefully we'll be able to incorporate into our clinical practice moving forward.